Good evening, friends. You are most welcome to Think IS channel. Today we are going to discuss the gist of India Yearbook 2022, which is written by GSS Code, and our topic is Health and Family Welfare. The Ministry of Health and Family Welfare earlier had two departments: the Department of Health and Family Welfare and the Department of Health Research. Department of AIDS Control was merged with the Department of Health and Family Welfare in 2014 and is now known as National AIDS Control Organization NACO NACO. Management of COVID-19. World Health Organization WHO declared COVID-19 a pandemic on March 11, 2020 and asked all countries to take urgent and aggressive action against the public health crisis. The government undertook the COVID-19 challenge up front. It took the bold decision to announce the nationwide lockdown that involved the community. The government initiated a series of actions to prevent the entry of disease and to contain its spread. 11 empowered groups were constituted on March 29, 2020 on different aspects of COVID-19 management in the country to take or to make informed decisions on issues. Community surveillance was initiated for travel related cases and subsequently for cases being reported from the community by Integrated Disease Surveillance Program IDSP. The containment plan released by the Ministry of Health and Family Welfare envisaged a strategy of breaking the chain of transmission by first defining containment and buffer zones, second applying strict perimeter control, third intensive active house to house search for cases and contacts, fourth isolation and testing of suspect cases and high risk contacts, fifth quarantine of high risk contacts, sixth intensive risk communication to raise community awareness on simple preventive measures and need for prompt treatment seeking, and sixth and seventh strengthening of passive influenza like illness ILI or severe acute respiratory illness SARI surveillance in containment and buffer zones. Three-tier arrangement of health facilities was created for appropriate management. It includes COVID care center with isolation beds for mild or pre-symptomatic cases, dedicated COVID health center DCSC with oxygen supported isolation beds for moderate cases, dedicated COVID hospital DCH with ICU beds for severe cases, tertiary care hospital under Employees State Insurance Corporation ESIC, Defense, Railways, Paramilitary Forces and Ministry of Steel have been leveraged for case management. To ensure accessibility of quality treatment for both COVID-19 and non-COVID-19 health issues to far-flung areas, the use of telemedicine has been promoted in a big way. eSanjeevani, a web-based comprehensive telemedicine solution, is being utilized in 23 states to extend the research of specialized healthcare services to masses in both rural areas and isolated communities. Indian Council of Medical Research ICMR is establishing a national clinical registry on COVID-19 that will provide insights into the clinical course of COVID-19 disease, its spectrum and the outcome for patients. Pradhan Mantri Garib Kalyan Package Insurance Scheme to support the states or UTs under the whole of government approach, the central government extended the Pradhan Mantri Garib Kalyan Package PMGKP insurance scheme for health workers fighting COVID-19 till April 2022. The scheme was launched in March 2020, initially for 90 days to provide comprehensive personal accident cover of 50 lakhs to all healthcare providers. This includes community and private healthcare workers for the care of COVID-19 patients and for those who may come in direct contact with affected persons. The scheme is implemented through the insurance policy of the New India Assurance Company. National Health Mission. The National Health Mission NHM encompasses its two submissions, the National Rural Health Mission NRHM and the National Urban Health Mission NUHM. The main programmatic components include health system strengthening, reproductive, maternal, neonatal, child and adolescent health NMNCH+A and control of communicable and non-communicable diseases. The NHM envisages the achievement of universal access to equitable, affordable, and quality healthcare services that are accountable and responsive to people's need. Maternal and child health. Mission Indradhanush, it was launched in 2014 to cover all those children who have been partially vaccinated or not vaccinated during routine immunization rounds. New vaccine, inactivated polio vaccine IPV in concurrence with the World Polio Endgame Strategy IPV was introduced in November 2015 in 6 states and expanded throughout the country by June 2016. Retrovirus or rotavirus vaccine RVV. This vaccine was launched in March 2016 to reduce the burden of diarrhea caused by rotavirus. Rubella vaccine as measles rubella MR vaccine. MR measles rubella vaccine is being introduced through a campaign targeting around 41 crore children in the age group of 9 months to 15 years, followed by 2 doses in routine immunization at 9 to 12 months and 16 to 24 months. Adult JE vaccine, Japanese encephalitis. Japanese encephalitis vaccine in children was introduced in 2006. However, the vaccine was expanded in the adult population of districts with a high disease burden in 2015. Pneumococcal conjugate vaccine PCV. This vaccine was launched in May 2017 to reduce child death due to pneumonia, which is a major cause of child mortality. Tetanus and adult diphtheria TD vaccine. Increase in immunization coverage in children led to a shift in the age group of diphtheria cases to school going children and adults. Subsequently, tetanus and adult diphtheria TD vaccine was recommended by the National Technical Advisory Group on Immunization NTAGI in 2016. Rashtriya Bal Swasthya Karyakram. This initiative, launched in 2014, entails provision for child health screening and early intervention services through early detection and management of 4Ds, that is, defects at birth, disease, deficiencies, development delays including disability, and free management of 32 identified health conditions including surgery at tertiary health facilities. Rashtriya Kishore Swasthya Karyakram. The Rashtriya Kishore Swasthya Karyakram RKSK was launched in 2014 to provide information, commodities, and services to meet the diverse needs of adolescents. The program expands the scope of adolescent health programming in India beyond sexual and reproductive health. The interventions under RKSK are weekly iron folic acid supplementation program entails the provision of weekly supervised IFA tablets to in-school boys and girls and out-of-school girls for the prevention of iron and folic acid deficiency. The scheme aims to ensure that adolescent girls have adequate knowledge and information about menstrual hygiene, use of sanitary napkins, and environmentally safe disposal mechanism. Peer educator programs aims to ensure that adolescents are benefited from regular and sustained peer education covering nutrition, sexual and reproductive health, conditions for non-communicable disease, NCDs, substance misuse, injuries and violence, including gender-based violence and mental health. Mother's Absolute Affection MAA program. Mother's Absolute Affection is an intensified program to bring undiluted focus on promotion of breastfeeding and other infant and young child feeding practices. The goal of MA program is to revitalize efforts towards the promotion, protection and support of breastfeeding practices through health system to enhance breastfeeding rates. Lactation Management Centers. Lactation Management Centers LMC are being established at high delivery load facilities to provide comprehensive support for lactation management. It includes comprehensive lactation management centers CLMCs and lactation management units LMUs. In CLMCs, there is a provision of donor human milk DHM collected from the mothers who voluntarily donate their excess breast milk free of cost for the newborns who have no access to their own mother's milk. LMU lactation management centers and lactation management units facilitate lactation support to the mothers so that newborns can be breastfed successfully or provided mother's milk. Janani Suraksha Yojana. Janani Suraksha Yojana JSY is a safe motherhood intervention under the National Health Mission. The objective is to reduce maternal and neonatal mortality by promoting institutional delivery among poor pregnant women. प्रधानमंत्री सुरक्षित मातृत्व अभियान प्रधानमंत्री सुरक्षित मातृत्व अभियान PMSMA was launched in 2016. This program aims to provide assured, comprehensive and quality antenatal care free of cost universally to all pregnant women on the ninth day of every month. PMSMA guarantees a minimum package of antenatal care services to women in their second or third trimesters of pregnancy at designated government health facilities. It focuses on improving the quality of care during antenatal visits, besides identification and line listing of high risk pregnancies based on obstetric medical history and existing clinical conditions. Anemia Mukt Bharat. In 2018, Anemia Mukt Bharat AMB strategy was launched to achieve the envisaged target of a 3% reduction in anemia prevalence every year under the Poshan Abhiyan. The sixth intervention under the Anemia Mukt Bharat strategy are prophylactic iron folic acid supplementation, periodic deworming, intensified year-round behavior change communication campaign, including delayed cord clamping, testing and treatment of anemia using digital methods and point of care treatment, mandatory provision of iron folic acid fortification or fortified foods in public health programs, and addressing non-nutritional causes of anemia in endemic pockets with a special focus on malaria, hemoglobinopathies, and fluorosis. Nutrition Rehabilitation Centers. Nutrition Rehabilitation Centers (NRCs) are facility-based interventions to provide medical treatment and nutritional management to under 5-year children suffering from severe acute malnutrition (SAM) with medical complication. Nutrition Rehabilitation Centers. Rehabilitation centers are facility-based interventions to provide medical treatment and nutritional management to under 5-year children suffering from severe acute malnutrition (SAM) with medical complications. Now we will discuss Ayushman Bharat, which is most important topic. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana ABPMJAY was launched in 2018, subsuming the erstwhile Rashtriya Swasthya Bima Yojana RSBY. Around 10.74 crore poor and vulnerable families, approximately 50 crore individuals, are entitled under it to cashless and paperless access to services at the point of service, that is, impanel hospitals. This health cover includes 3 days of pre-hospitalization and 15 days of post-hospitalization expenses. There is no cap on family size, age or gender to ensure that all members of the beneficiary families are covered. Also, benefits are portable across the country. Ayushman Bharat Health and Wellness Centers. The first component of Ayushman Bharat pertains to the creation of 1,50,000 Ayushman Bharat Health and Wellness Centers ABHWCs by upgrading the sub-health centers HSCs and rural and urban primary health centers PSCs to bring healthcare closer to the community. This target also includes the creation of 12,500 Ayush HWCs by upgrading Ayush dispensaries and a few SSCs to provide Ayush primary healthcare services. These centers will provide comprehensive primary healthcare (CPSC) by expanding and strengthening the existing reproductive and child health (RSC, RCH) and communicable disease services, and by including services related to non-communicable diseases, and by incrementally adding primary health services or primary health care services for mental health, ENT, ophthalmology, oral health, oral health, geriatric, and palliative care and trauma care, as well as health promotion and wellness activities like yoga. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, in an attempt to move from a sectoral and segmented approach to health service delivery to a comprehensive need-based healthcare services, Ayushman Bharat's second component, Pradhan Mantri Jan Arogya Yojana, was designed to be interlinked with the health and wellness centers in a continuum of care approach launched in September 2018. Ayushman Bharat PMJAY Jan Arogya Yojana is the largest health assurance scheme in the world, fully financed by the government, and the cost of implementation is shared between the central and the state governments. Households are included based on the deprivation and occupational criteria of Socio-Economic Caste Census 2011 (SECC 2011) for rural and urban areas respectively. National Tuberculosis Elimination Program. The National Tuberculosis Elimination Program (NTEP), erstwhile revised National Tuberculosis Control Program, is an ongoing centrally sponsored scheme implemented tuberculosis prevention and control activities in a mission mode to achieve a rapid decline in the burden of TB morbidity and mortality towards ending TB in India by 2025. Under NTEP, National Tuberculosis Elimination Program, the government provides free diagnostics and quality assured drugs along with finance assistance of Z 500 per month during treatment for all TB patients in the country. Altogether, with 22,198 microscopy centers, all the districts have been linked to rapid molecular testing labs, a total of 3,760, and 689 districts have established functional DRTB centers. TB Mukt Bharat Abhiyan (TMBA) was launched to further build awareness about TB, address the deep-seated stigma around the disease in the community, raise awareness, and generate demand for free TB diagnostics and treatment services. Mental health care. To address the challenge of mental illness, the government is implementing the National Mental Health Program (NMHP) in the country. Under NMHP, implementation of the District Mental Health Program (DMHP) has been approved for 692 districts of the country for early detection and management of mental disorder or illness. The Mental Health Care Act 2017, which came into force on May 29, 2018, seeks to provide mental health care and services for persons with mental illness and to protect, promote, and fulfill the rights of such persons during the delivery of services. Medical education. The National Medical Commission Bill 2019 for setting up a National Medical Commission and repealing the Indian Medical Council Act 1956 was passed by the Parliament. The Act was notified on 8th August 2019. It aims to improve access to quality and affordable medical education, ensure the availability of adequate and high quality medical professionals in all parts of the country, promote equitable and universal health care that encourage a community health perspective, and make services of medical professionals access to all the citizens. Phase 3 of the centrally sponsored scheme was approved in 2019 to establish 75 new medical colleges. The total cost per college is estimated at 325 crores with a fund sharing ratio of 90:10 for Northeast and special category states and 60:40 for other states. Pradhan Mantri Swasthya Suraksha Yojana. The Pradhan Mantri Swasthya Suraksha Yojana PMSSY envisages the creation of a tertiary healthcare capacity in medical education, research and clinical care in the underserved areas of the country. It aims to correcting regional imbalance in the availability of affordable or reliable tertiary healthcare services and also augment facilities for quality medical education in the country. PMSSY Pradhan Mantri Swasthya Suraksha Yojana has two components: projects involving the setting up of new aims like institutes and the upgradation of existing government medical colleges GMCs. Indian Council of Medical Research. As one of the oldest medical research bodies in the world, the Indian Council of Medical Research (ICMR) was established in 1911 as the Indian Research Fund Association (IRFA). ICMR has spearheaded the planning, formulation, coordination, implementation, and promotion of biomedical research both in India and internationally. It has remained the apex and premier medical research organization in the country through its commitments to research, professional development, collaboration, and knowledge dissemination across its disease specific 26 research institutes, as well as through extramural funding of funding to medical colleges, universities, other science and tech agencies, and non-governmental organizations. ICMR has made significant scientific contributions to understanding various diseases of national importance such as malaria, Japanese encephalitis, tuberculosis, HIV/AIDS, Kala Azar, filariasis, leprosy, and poliomyelitis. ICMR has also demonstrated its commitment to current public health concerns including nutrition, reproductive and maternal and child health, occupational and environmental health, and health systems research. Its research output and impact have demonstrated considerable and constant growth. Food Safety and Standards Authority of India. Food Safety and Standards Act was enacted in 2006. The Food Authority is assisted by scientific committee and panels in setting standards and the Central Advisory Committee in coordinating with enforcement agencies. The Food Authority guides and regulates all persons engaged in manufacturing, processing, import, transportation, storage, distribution, and retails of food on issues of food safety and nutrition, with primary responsibility for enforcement largely with the commissioners of food safety of states and duties. Drugs. Sugam portal by the Central Drug Standards Control Organization CDSCO enables online submission of application, their tracking, processing and grant of approvals online mainly for drugs, clinical trials, ethics committees, medical devices, vaccines and cosmetics. It provides a single window for multiple stakeholders, pharma industry, regulators, citizens involving in processes of CDSCO. E-Health, National Digital Health Blueprint (NDHB). The committee constituted by the Ministry of Housing, Finance and Welfare to create an implementation framework for the national health फिर से देख लेते हैं इसको National Digital Health Blueprint (NDHB). The committee constituted by the Ministry of Health and Family Welfare to create an implementation framework for the National Health Stacks (NHS) has come up with the National Digital Health Blueprint after surveying the global best practices in the adoption of digital technology holistically. The key features of the blueprint include the federated architecture, a set of architectural principles, a 5-layered system of architectural building blocks, unique health IDs (UHID), privacy and consent management, national portability, electronic health record (EHR), applicable standards and regulations, health analytics, and above all, multiple access channels like a call center, Digital Health India portal, and My Health app. On August 15, 2020, the National Digital Health Mission (NDHM) was implemented in the country. Currently, NDHM is being implemented in 6 union territories for pilot implementation. Center for Health Informatics (CHI). The Center for Health Informatics (CHI) has undertaken multiple activities relating to e-governance or e-health for improving the efficiency and effectiveness of the healthcare system to achieve universal health coverage. Sanjeevani and e-Sanjeevani OPD. Sanjeevani, the telemedicine platform of Ministry of Health and Family Welfare, supports two types of telecom ration services, doctor to doctor. It is known as e-Sanjeevani, and patient to doctor. It is called e-Sanjeevani OPD. Teleconsultations. E-Sanjeevani is an important component of the Ayushman Bharat Health and Wellness Center (ABHWC) program. It was rolled out in November 2019 and aims to implement teleconsultation in all the 1.5 lakh health and wellness 1.5 lakh health and wellness centers in the hub and spoke model by December 2022. National Health Mission in the states identifies and sets up dedicated hubs in medical colleges and district hospitals to enable teleconsultation services to spokes set up at special health centers and primary health centers. Let's repeat this. Sanjeevani and e-Sanjeevani OPD. Sanjeevani, the telemedicine platform of Ministry of Health and Family Welfare, supports two types of telecommunication services, doctor to doctor. It is known as e-Sanjeevani, and patient to doctor. It is called as e-Sanjeevani OPD teleconsultations. E-Sanjeevani is an important component of the Ayushman Bharat Health and Wellness Centers (ABHWC's) program. It was rolled out in November 2019 and aims to implement teleconsultations in all the 1.5 lakh health and wellness centers in a hub and spoke model by December 2022. National Health Mission in states identifies and set up dedicated hubs in medical colleges and district hospitals to enable teleconsultation services to spokes set up at special health centers and primary health centers. Ayush systems of healthcare. Ayush system of healthcare. Ayurveda. Ayurveda literally means science of life. Ayurveda is involved from the various Vedic hymns rooted in the fundamental philosophies about life, disease, and health. The Charak Samhita and the Sushruta Samhita, developed around 2500 BC, are the main treatises of Ayurveda fully available today. Ayurveda takes an integrated view of physical, mental, spiritual, and social aspects of human being and interrelationship between these aspects. Yoga. Yoga is essentially spiritual, and it is an art and science of healthy living which focuses on bringing harmony between body and mind. The word yoga has two meanings. The first comes from the root usir or union. The second is derived from the different root yuja, which means samadhi, the highest state of mind and absolute knowledge. These two are most important meaning of the word yoga according to Panini, the most well-known Sanskrit grammarian. Naturopathy. Naturopathy is a system of medicine that advocates harmonious living with constructive principles of nature on physical, mental, moral, and spiritual planes. Unani. The Unani system of medicine originated in Greece and passed through many countries before establishing itself in India during the medieval period. It emphasizes the use of naturally occurring, mostly herbal medicine and some medicines of animals, marine and mineral origin. The government of India facilitated the growth and development of Unani medicine by recognizing its utility and scope and integrating it into the healthcare delivery system. With its wide network of quality educational institutions, comprehensive healthcare facilities, state of the art research institutions, and quality drug manufacturing industries, and on account of its utilization by a large number of people for their health care needs, India has emerged as the global leader in the Unani system of medicine. Siddha. The Siddha system is considered the mother medicine of ancient Tamils or Dravidians in the South India. It provides preventive, promotive, curative, rejuvenates, and rehabilitative healthcare with the holistic approach. Siddha system is said to be a divine and holistic system of medicine as it offers excellent medicines and lifestyle guidelines for healthy living. The Siddha system is involved based on 96 tools of principles, tattvas, which include the physical, physiological, psychological, and intellectual aspect of every human being. According to the Siddha system, matter and energy are the two major entities which account for the formation of the universe and its contents. Homeopathy. The physicians from the time of Hippocrates around 400 BC had observed that certain substances could produce symptoms of disease in healthy people similar to those people suffering from the disease. Dr. Christian Friedrich Samuel Hahnemann, a German physician, scientifically examined this phenomena and codified the fundamental principle of homeopathy. Homeopathy was brought in India around 1810 AD by European missionaries and received officially recognition by a resolution passed by the Constituent Assembly in 1948 and then by the Parliament. Swarigpa. Swarigpa. Swarigpa is among the oldest surviving health tradition in the world with a living history of the more than 2500 years. It has been in vogue it has been in vogue and practiced in Himalayan regions, particularly in Leh and Ladakh, Jammu and Kashmir, Himachal Pradesh, Arunachal Pradesh, Sikkim, Darjeeling, etc. Sowa Rigpa is effective in managing chronic disease like asthma, bronchitis, arthritis, etc. The basic theory of Sowa Rigpa is explained in terms of first, the body and the mind as the locus of treatment. Second, antidote. Third, the treatment, antidote and the treatment. Third, the method of the treatment through antidote. Fourth, medicine that cure the disease. And lastly, fifth, pharmacology. Suvarikpa emphasizes the importance of the cosmological physical elements in the formation of human body. Thank you very much.